I'm Kathy Bradshaw.
And I'm John Bradshaw.
Okay, well, my primary health concerns were I had been to my regular doctor and I had some various symptoms in various places that seemed random, and I was not getting any good answers. Case in example, swollen lips and area under there. I was told that, well, Kathy, don't worry about it. When people get older, their face changes. And then the same with a leaky bladder issue and just random things. Didn't really know where to go or what to do. It was just before COVID hit. And November of 2020, I spoke to a friend and I said, I don't know who to go to or what to do. And she said, well, why don't you go to the Averio Institute? And I basically said the what? And it was 45 minutes from our home. We made an appointment. I looked at my husband and I said, I'm going, you want to come with me? And he did, and there's been no looking back. There was plenty of reasons and causes, and they are being addressed in a way that I could have never imagined. It's healthcare the way it should be.
For myself, personally, mine was, I thought, pretty simple. My lower back was really bothering me. And I worked at an aluminum smelter for 13 years, and I did extreme physical work. And my only thing I really wish that I'd been able to come to some place like this, 40 years ago. I would have saved a lot of pains in future. And during that time, my back certainly wasn't getting any better. So I'm really happy that I was able. And like Kathy was saying, that we just had a friend that mentioned this place, and I know I have been extremely happy with all the service and everything. So.
I think for me it would have been a matter of more symptoms and then some major disease, and then wherever that leads you down the hellhole of traditional, sick care as we now have. I think for me, and just from today's consultation with John with his neck, I mean, he was one bump away from paralysis.
Yeah, it was very sobering to realize how bad my back was. Like I said, it was my lower back. Well, no, it wasn't. It was up in my upper spine that the problem was occurring. Yeah. And like I said, I've had excellent help here. I feel, and every day I come here, I can see the improvement. Yeah. I can feel it. And it's a change of life, a change of lifestyle.
And needless to say, my whole cervical and other parts of my spine were a mess. I mean, all the ligature's gone, all of the discs degenerated and whatnot, and all of that is on the mend, and hence is coming to improved health.
I got to say, at Averio, that they treat the cause, not just the symptom. And general medical practitioners, unfortunately, they treat the symptoms, and normally that's with prescriptions and medication. And that's, to me, is a paramount important thing to be doing.
And who the heck can email their regular medical doctor and get a reply?
That's very true.
Yeah.
Very true.
Very awesome.
Awesome.
Well, number one, the food is delicious. And you're here for concentrated care, but it does give you 5 days of not having to think too much about your meals and what and how you're eating. And food is an integral part of the program, and there's lots of resources there. And we were already, about 50% along of making some changes in our diets before we got here, but this definitely sped it up. The other part is the education big time. It's like why you're being asked to do what you're doing, and why you as a patient have to have critical participation in your well-being, and it's a choice. And then of course then there's all the state-of-the-art equipment and devices that are part of the care package that is, I'm sure, unlike anything else in this country. That's what I've been told, and I believe it. It's absolutely amazing. So those are some of the things. And then you have a team of specialists looking after you. And you have a team of doctors and assistants and everybody in the institute who works here. They're a team and they're a family, and they invite you in and it's part of their team and the family, and you work towards the cause of getting the results.